How accurately does MSLT diagnose sleep disorders? Imagine lying down for a nap and having a doctor watch how fast you fall asleep and whether you enter REM sleep quickly. That's what the multiple sleep latency test does. It's a special test that measures how sleepy you are during the day. The test is best at diagnosing narcolepsy type 1, where people fall asleep very quickly and often enter REM sleep within about 8 minutes. If you have at least to sleep onset REM periods, it's a strong sign of narcolepsy. But the test isn't perfect for all sleep problems. For example, in idiopathic hypersomnia, which causes extreme daytime sleepiness, the MSLT can sometimes miss the mark. Many people with this condition show normal results on the test, even though they feel very sleepy. In fact, over 30% of these cases might have normal MSLT results, so the test isn't very reliable on its own for this disorder. When it comes to sleep apnea, the MSLT isn't the main tool. Sleep apnea is usually diagnosed with an overnight sleep study called a polysomnography. This test records breathing, oxygen levels, and other body functions during sleep. The MSLT is often done after the sleep study to see how sleepy someone is during the day. But it doesn't directly detect breathing problems or pauses during sleep. So, it's not very accurate for diagnosing sleep apnea itself. Overall, the MSLT has low sensitivity, meaning it can miss many cases of sleep disorders. It might only correctly identify about 12% of people with certain sleepiness issues. Its ability to correctly rule out those without the disorder, called specificity, is moderate. Factors like medications, depression, or poor sleep habits before the test can also affect the results. In practice, the MSLT works best as part of a full sleep evaluation. Usually, a person first has an overnight sleep study to rule out sleep apnea or other issues. The MSLT then helps confirm narcolepsy or other hypersomnolence disorders. It's a helpful tool but should never be used alone to diagnose sleep problems. When combined with clinical history and other tests, it provides a clearer picture of what's going on. To sum up, the MSLT is very good at diagnosing narcolepsy type 1. But for other sleep disorders like idiopathic hypersomnia or sleep apnea, it's less accurate. It's a piece of the puzzle, not the whole picture. Proper diagnosis depends on a combination of tests, medical history, and careful assessment by a sleep specialist.